Hi, this is Mahony. I'm a specialist orthodontist from Sydney, Australia. I also have further training in dental sleep medicine. And over the last 10 to 15 years, I've been treating a lot of my patients who suffer from signs and symptoms of sleep disordered breathing, such as snoring, mouth open at night, obstructive sleep apnea, etc. And we find now oral appliance therapy can be as effective as a CPAP machine. But both the CPAP and the oral appliance can be improved in their efficiency if you can teach the patient to breathe through their nose. Many of my patients have collapse of their nasal valve, so it's difficult for them to use that as their main portal of airway. So that's why I'm working with this company. The company is called Rhinomed, and they have an excellent product called Mute. What is Mute? Basically, it is nasal valve plugs that allows a patient improvement in breathing at night. I have many children who have septal deviations, but they can't have that operated on until they're 18. I have other adult patients who don't want to have the septoplasty. So I must stress to you that you need to work with an ear, nose and throat doctor to assess what the problem is. But part of the treatment solution can be the use of this product. We know that if we can sleep with our mouth closed and breathe through our nose, we get better quality sleep. And there's been a number of clinical trials which show results such as 78% of the people could breathe better at night with Mute, 75% snored less, and 73% of the partners noted the severity of snoring had reduced. So if you'd like a copy of the clinical paper, feel free to send me an email. I'll have my email appearing at the bottom of this video. We actually sell this at our practice because we find it's convenient for our patients, but you may just want to recommend it to your patients and then they can buy it from the pharmacy. Now, the way you measure the size you need is simply with this brochure. And you can see you have a small, medium or large, and by using this ruler you can see which size will fit. Alternatively, you can buy the intro pack. The intro pack is the purple pack. And the intro pack has a small, medium, large. You see which one works the best for you, and then in future you can reorder just that size. I find that I can use this on average 10 nights. So one pack would last me about a month, but it makes a huge difference to my breathing at night time. So
if you just have the rings facing towards you, we have these little straps here which are adjustable. You can pull them in and out just in case one side is a little bit larger than the other. You can pop one side in there like that, and then the other side in, and if you just push it up and sort of angle it back, you should immediately feel more air flowing through.
I find that any doctor recommending this should actually use it themselves to see how effective it is, and that's what I've done, and it's really helped me. I've had very poor quality orthodontics as a child. They took out a lot of teeth, they pulled everything back, so I have what's called base of tongue obstruction issues. I also, as you can hear from my nose, suffer a lot from allergic rhinitis. So I find an oral appliance works well for me, but an oral appliance with the Mute is even more effective, and it's not a big routine to put this in before you go to sleep. So I'd recommend you try this yourself before you recommend it for your patients. So thanks again for listening, and any further inquiries, happy to answer them through my email address.